That was great. Yay. Look at her. Look at her. Look at her. Beautiful. We've all seen these videos. A baby's just born and you see this really aggressive either stimulation, drying off. What the heck is going on? So I'm going to tell you. My name is Kara. I'm a mother-baby nurse and a mom of 3, and I am also NRP or Neonatal Resuscitation Protocol certified. Anytime a baby is born, we follow this systematic algorithm. This is part of NRP, what you're supposed to do at any birth. Look how many things we assess just in the first minute of life. So the big ones are, how is their tone? Are they breathing? They're crying. In that video, you notice mom did have baby skin to skin, but they were doing some pretty aggressive drying off, and that is the first step of NRP. In nursing, we always care about the ABCs, so airway, breathing, and circulation. So we're gonna stimulate them, we're gonna make sure their airway is functioning properly. If not, we're gonna suction them, and we're just gonna really dry. If they have apnea, which means they're not breathing, they're gasping, or their heart rate is below 100, that's when we're going to move on to more advanced steps in the algorithm. Also, at 1 minute and 5 minutes of life, we are giving baby an APGAR score. So we're looking at their things like their color of their skin, their pulse, heart rate, their reflexes, how they're responding to stimulation, their tone, are they really floppy or not, and their breathing. Are they not breathing at all, or do they have a strong cry? If you are pregnant or you've seen these videos, you've had a baby in the past, and you're like, what the heck were they doing? Why were they doing what they were doing? We aren't just arbitrarily doing a bunch of crazy stuff that looks crazy. Although it does look crazy, but there is a purpose and a systematic algorithm that we follow, the steps that we follow in a very short time frame. So while it looks intense, like we're doing a lot of stimulation to really wake that baby up, dry them off, we would rather do that first initially before having to do something more advanced, like an advanced airway, other things that go farther down into the algorithm. Like you saw in the video, 99% of the time, baby can come out and the assessments and everything can be done with baby skin to skin, unless we know of something concerning where we might know that they need to go straight to the warmer to be assessed. But most of the time, it can all be done right there unless we know they need more advanced interventions. Some people ask about home births. Yes, if you have a home birth, your midwife or whoever's there should be NRP certified, so still should be following these systematic steps and assigning APGARs to your baby. So I hope this was helpful. Follow along for all things birth, postpartum, pregnancy, and send to any of your friends who are having a baby.